Have the doctor write in. Thank you.
Ready?
Okay, so I have Mackenzie in room 1. She would like a breast augmentation with a lift. These are the photos we've captured of her today.
Okay, so this patient, we're going to be removing some tissue as we lift. So I'm going to estimate here on the reduction. I think I can get off about 75 cc's on each side. So then I go into implants. I know the patient's breast width, so using that diameter of around 11.7, 11.8. And after our discussion of how much projection and how enhanced or prominent she wants to be, we selected a boost implant. Based on her diameter and wanting to be about 2 cup sizes up, I'm selecting the 355 cc implant. She needs a lift, so I'm going to go in here to shape. We're going to lift that nipple areolar complex up. Sometimes it's helpful to go from the side. I know in doing my lift, I'm going to increase or lift the lower pole, so lower pole reduction. So my final result's going to be something kind of like this, where we have 355 cc moderate high boost implants with a mastopexy and removing some of her own tissue or native tissue in doing that. This allows me to show different volumes of both the upper and lower pole. I can show the patient how the scar is going to be. For her, it would be a vertical mastopexy, so a lollipop type configuration. If we wanted to, we could adjust either the size of the areola diameter as well as the position of those, which there's some nice specifications there. I'll take those scars back off for now. The other thing that's nice with this is we can show, I'm gonna take that off. We can show from different perspectives. So this would be from the patient's own perspective, kind of before and after. And this would be a different perspective that way. So nice result to me with a 355 cc moderate high boost implant and a small reduction of her native tissue. I think that's a really accurate representation of what I've hoped to achieve with her.
Hello. It's
Okay, so Kinsey, this is the fun part. We're going to show you some augmented reality, some simulation of what your results might be like after surgery. So I've put in what I think is consistent with what you've expressed as your goals, both in cup size and how obvious or not it's going to be. But the fun thing is you can say, no, that's too big, or that's too small, or I want more, or whatever. So we'll be able to play around with it. So again, I'm going to start with what I think you presented to me, and we'll go from there. So I'm going to put you on the big screen, okay? What I'm going to start with is where you're starting from now. So these pictures will look familiar, and then I'll show you the simulation. Okay, so Kinsey, this is where we're at. Kind of fun to look at. So again, we have some of that settling, that ptosis. We want more fullness up top. We're going to do all that. So the first image that I'm showing you is a 355 cc implant with the lift, okay? And that would look something like that. So again, this shows the lift. What I can do is put on here the scars that we would have. They would look something like that. And that's the position that they would be in, okay? What are your thoughts?
I do like that. Could you show me something a little bit bigger?
Yeah, so the next implant up would be probably this one. This is a 440 cc implant. You see the difference there? I'll go back and forth, okay? 355, 440. 355, 440. So basically the nipple position's coming out more. You're getting a little more fullness across the top as we go larger. What are your thoughts?
Okay, I do like that, but for fun, can I see one smaller?
Sure. Let me go one down. Let's see. Okay. That would be a 320 cc implant. So you're going to see that. Ready? 1, 2, 3. See the difference there?
Mm-hmm.
Fairly subtle difference, but you can see a difference.
Okay, I do like the first one you showed me.
Great. Yeah, I think it's a great choice. We'll go with that.
Okay.